Hi everyone, my name is Simone Evett and I'm an MS2 and one of the Financial Literacy Merit Service Scholars for this year. And today I'm going to be talking about health insurance. So you might be wondering, why is this part of financial literacy? Well, first, health insurance costs can be a significant expense in the medical student budget. We are required to have health insurance as medical students. And I know many of my classmates are, turning 26 soon, or they might already be 26, and so they can't be on their parents' insurance any longer. So this is definitely a new cost that has to be budgeted for. And then, of course, we all know that healthcare can be really expensive, and if you have unexpected medical expenses that come up because of a major illness or an accident, these costs can be financially devastating without the right insurance. And so the purpose of this talk is really just to help give some guidance on how to choose the right plan for you, because this can result in significant cost savings, both upfront and also if anything unexpected happens. So my talk today is going to cover three main topics. First is choosing a plan. Two is looking at different types of plans. And three is looking at options for health insurance for medical students. And my talk it's focused on medical students, but a lot of the information I think is very relevant even beyond medical school when you're out with your first job and you need to pick a health insurance plan that's provided by your employer. Hopefully the topics that I talk about today will help just give you background information to better make a decision about that. Okay, so jumping right into choosing a plan, there are a bunch of different cost considerations that come along with choosing a health insurance plan, and I have some of the key terminology here on this slide. Basically, when you purchase health insurance, you're entering into a contract with a health insurance company, and so you buy the plan, and then the company agrees to pay for some portion of your medical costs. And these terms on the slide help kind of divvy that up. So first, for the of having health insurance coverage, you have to pay the health insurance company every month, and that is called your premium. And then the way that the insurance company splits costs with you is kind of covered in the remaining terms on the slide. So first, there's a deductible amount, which is the amount that you have to pay out of pocket per year before your insurance plan actually pays anything. Then you have a copayment, which is a fixed dollar amount that you pay to the healthcare provider every time you get care. And I want to note that the copays generally don't count towards the deductible, but they do count towards the out-of-pocket maximum, which I'll talk about in a second. And also there is coinsurance. So this is the percentage of each bill that you have to pay out of pocket. And this kicks in after you reach the deductible amount. And then lastly, we have an out-of-pocket maximum. So this is the maximum out-of-pocket amount that you could spend per year. It's kind of like a cap on how much you have to pay. And then after you reach that cap, the insurance plan will pay 100% of the covered services. So all of that terminology can be a little confusing, so I wanted to give a quick example just to make it hopefully more clear. So in this example, you want to go visit your PCP, and each visit costs $200. The plan that you have a $100 deductible, a $20 copay for the PCP visit. You have 75-25 coinsurance, which basically means that the insurance company will pay 75% and you will pay 25%. And then the out-of-pocket maximum on this plan is $2,500. And in this example, we're going to assume that it's the first visit of the year. You don't have any other medical bills this calendar year so far. So for the first visit to your PCP, which costs $200, you're going to have to pay your deductible, which is $100, plus the copay, which is $20 for a PCP visit, plus $25 coinsurance on the remaining amount of the bill, which is $80. So the total amount is $140 that you would pay out of pocket for this visit. And then if you were to need to go to see your PCP again, assuming you didn't have any other medical costs, this visit is also $200, and you already met your deductible, so there's no more that you need to pay towards your deductible, but you'd have to pay $20 for the copay and then 25% coinsurance on the remaining $180. So for this visit, your out-of-pocket total would be $65. And so from these two visits, you have paid $205 total out of pocket. So this all counts towards your out of pocket maximum of $2,500. But you would still need to spend about $2,300 to actually reach that maximum where insurance kicks in and would pay 100% of everything. Okay, so now that you have a better background on some of the common components of a health insurance plan, when you're actually choosing a plan, there are lots of other factors you need to consider. First, you want to make sure that you're balancing the cost of the plan versus the coverage that you're getting, and this is really dependent on the person and your needs. Um, if you're a healthy person, you might be willing to enroll in a plan that has a lower monthly cost, but that has a high deductible because you don't anticipate a lot of medical costs. But if you're someone with a chronic illness, or you have a young family with kids that are more prone to getting sick, then it might make more sense to pay the higher premium cost monthly for better coverage if you are going in to seek care more frequently. If you are likely to access care frequently, those deductibles, copayments, and coinsurance can really add a lot to your total yearly costs. So maybe you should be looking for a plan that might have a higher premium but lower costs associated with accessing care. Also, some other factors to consider is access to your preferred doctors and hospitals. Some health insurance plans provide only limited or actually no coverage when you access care from an out-of-network provider. So, if you need to check if you want to stay with your current PCP, that they actually accept the insurance that you're choosing. Another important consideration is what is the prescription drug coverage. If you have to be on certain medications, the insurance plans will publish the list of drugs they cover, but you want to make sure that the drugs that you need are actually on that list so that they will be covered and to minimize out-of-pocket costs for you. Now moving on to types of health insurance plans. So we have, but first of all, there are many different types of health insurance plans. I only listed the three that I thought were probably most relevant to medical students on this slide, but just be aware there are more. So first, I wanted to cover the Health Maintenance Organization, or HMO type of plan. So this is a plan that usually limits coverage to care from healthcare providers who specifically contract with the HMO. And a pro of this is that there are lower out-of-pocket costs associated with getting care, but a con is that you often need to go to your PCP first to get a referral to see any specialists. And also, if you do want to go see someone out of network, generally the plan won't cover that. So it gives a lot less flexibility in terms of the providers that you can see. The second type is Preferred Provider Organization, or PPO. So in this type of health plan, you pay less if you use providers that are in the plan's network. So similar to HMO, they have special contracts with certain providers, and you pay less if you go to see those. A pro of this is that there is higher flexibility because you don't need a referral from your PCP to go see any provider. You can just go. And also, they are more likely to cover out-of-network, at least partially out-of-network costs compared to the HMO. But a con is that they do have a higher out-of-pocket cost in general. You do pay a little more to have that higher flexibility. And then the last type of health insurance plan that I'll cover is Medicaid. So this is the government provided plan. It's covered by the state and federal government, and it's for people that have low income or disabilities. And the pros for this plan is that they're really low out-of-pocket costs. The con is that Medicaid often doesn't reimburse providers as much for the services provided, and so a lot of providers don't accept it as a health insurance, and so you might have limited provider availability. For this slide, I wanted to give an example of something you might see when you actually start working. So this is an example from a University of Hawaii employee with the 2024 health plan premiums and the different types of plans that are available for them to select. And so I have circled the monthly employee contribution column, which would be the estimated monthly premium payment that the employee would pay out of pocket. And I think an important thing to note about employer provided health insurance plans is that the employer usually offers a subsidized plan, so they contribute partially to your monthly premium. So that is actually the column to the right of the circle column is showing how much the employer will contribute to the plan. But the monthly premium is just, again, one component of deciding which plan to choose. It's still important to consider things like the deductible amount and the copayment, coinsurance rate, and out-of-pocket maximum. to determine which plan is right for you. I wouldn't just go based on the lowest monthly premium, because if you have a lower monthly premium, it might actually mean higher costs when you go to seek care. So this particular HMSA HMO plan has a lower deductible, out-of-pocket maximum, co-payments, and co-insurance percent that you're responsible for compared to that HMSA 75/25 PPO plan, even though the PPO has a lower monthly premium. So again, if you're like actually planning or you think you will need to seek care, it's going to be a lower cost with the HMO, even though the monthly premium is higher. Lastly, I wanted to talk about options for different health insurance plans for medical students. Note that there are probably other options, but this is where I would look if I were looking for a plan. So first, University of Hawaii does offer a student plan through HMSA, and this is a PPO type plan. I won't talk about everything on this slide, but I just wanted to point out that the premium for this is about $450 a month. But it does have a very reasonable deductible of only $50 annually, and the out-of-pocket max is only $2,500. So that is something you could budget for in, like an emergency account. Um, and also they do cover preventive screenings at no cost, like your annual exam, for example. And the coinsurance rate is 25% for in-network. And they also have 25% coinsurance for like urgent care and emergency room and specialist visits and stuff like that. So overall, it's a pretty solid plan for a student. Another place that you could look is the healthcare.gov marketplace. I did a quick search on this website, and it looked like for Hawaii, the only plan types available, you could get either an HMO plan through Kaiser or a PPO plan through HMSA. The specific plans available are classified into what they call metal categories. So there are four of them: bronze, silver, gold, and platinum. And you can see that as you go up in the metal category, the coinsurance rates get better and the deductible rates get lower. But the trade-off is that the monthly premium gets higher. I wanted to note for these plans that if you are trying to sign up through healthcare.gov, they do ask for your income. And if you try to sign up and your income is too low, they will actually redirect you to apply for Medicaid. You can still buy health insurance through this marketplace website. It's just you won't qualify for any of the discounts that would come, um, like with the silver category, for example. At certain income levels, they actually give you additional discount. But if you're too low, they don't give you any discount. So just something to be aware of. The last specific plan that I want to talk about is MedQuest, which is Hawaii's Medicaid. The eligibility for most people for this plan is primarily based on the income. So currently, if you make less than 138% of the federal poverty level, which is about $25,000 for a single person household, then you would qualify for Medicaid. There are multiple health plan options for this, which are listed on the slide. And a big benefit to MedQuest is that most medical costs are covered. So there's no cost really to you. So no copays or premiums or anything like that that you have to worry about. And they do have pretty extensive covered services. You can get all the primary and acute care, uh, you know, visits that you need. They also cover behavioral health, long-term services, and although it can be hard to find providers, they do have basic dental, vision, and hearing that is included in their benefits. And the best way to see if you qualify for this is to just apply, and they will tell you right away. Also wanted to note about MedQuest that it provides assistance to nearly a quarter of Hawaii's population, and many JABSOM students actually do get their health insurance through MedQuest. Lastly, I just wanted to mention private plans. It is possible to purchase a plan directly from a health insurance company, but this is something that you would have to research on your own. From my research, often these plans are more expensive, and so you likely need to shop around. But I mean, it could be an option for you as well. All right, so key takeaways from my presentation are: first, just make sure when you choose a plan that it's balancing cost and coverage for the things that you need, such as in-network doctor visits and prescription drug coverage and stuff like that. Also, it's important to understand plan differences, like especially between like HMO and PPO and those differences before you actually choose which one to enroll in. And also, lastly, for medical students, there are several options for health insurance. And I didn't know when starting at JABSOM that MedQuest was an option for medical students. So just wanted to put that out there that it is an option. And if you are interested, you should just apply and see if you qualify. And a final note, it is good practice to just check with your health insurance plan. You can either call them, you can look online for the list of benefits, or you look in the app before you receive any services. And this can just help you confirm what they will cover so you aren't shocked by a bill later on. These are my sources for this talk. And that is all I have for you today. Thank you so much. If you have any questions, please feel free to reach out to the financial aid office at medfas@hawaii.edu. And I'm sure any questions will be forwarded to me as appropriate. Thank you.